I want to thank each and every one of you for coming this evening to our What is Chiropractic and Spinal Care orientation. The reason it's so important to give this class, I believe, is because of the sad statistic that America ranks 38th worldwide in the health of its people. And so my purpose this evening is to inform, educate, and encourage you to rethink traditional viewpoints regarding health and health care. I feel so strongly about this subject that I've been giving this class every Thursday since the second week of September 1982. So I feel pretty strongly about this information, and hopefully it will be as meaningful to you as it has been for me in my life. I believe also that companies, not only people, need to have purposes for their existence. And I want you to know that the purpose of Hall Chiropractic is to help change the way that America thinks about health care. We want to help sick people get well, live longer, and better. And we believe we can do that through gentle, safe chiropractic care. According to a dictionary I once read, health is a condition of wholeness in which all the organs are functioning 100% all of the time. And health care should not be paying attention to your bodies when you've lost your health or when you're in pain, but health care should be a lifetime of attention that you pay attention to the changes that are occurring through the process of living. The healthcare scientists have formulated a model in which they have created something called the Health Index Scale. It's an imaginary scale that you are placed upon at birth. Some people, because of good genetics, because of their parents, because of God's grace, are placed very high on this health scale. Some people at birth are in the middle, and some people, unfortunately, because of poor genetics or other environmental factors or other things, are placed low towards what's called the threshold of dysfunction. And the threshold of dysfunction is an imaginary scale on this imaginary, it's an imaginary point on this imaginary scale where your body's defense mechanisms become overloaded. You're no longer in a state of being at ease, you're in a state of dis-ease. That's how they got the word disease. The body's no longer at ease, it's in a state of dis-ease. My job is to help raise your health index from the level of dysfunction high as we possibly can make it. And there are some things that we can do to help raise your health index, and you know many of them: proper sleep, proper exercise, proper nutrition, and keeping our body's systems and moving parts functioning as well as they possibly can. There are things that lower your health index towards this point of that is called the threshold dysfunction, and we call those stressors. And we're going to be talking a lot about these stressors in a few minutes. Chiropractors and chiropractic in general have done a very good job over the millennia of treating people that have injuries to the musculoskeletal system. In other words, the muscles, the joints, the nerves, and the bones. And in fact, chiropractic is an ancient healing art. The ancient Egyptians, the Greeks, the Romans, the Chinese, the Indians, the Aztecs, the Incas, the black African societies all utilize chiropractic principles in their healthcare delivery systems. They just didn't call it chiropractic. We've done a good job in chiropractic of treating people over the millennia. We've done a relatively poor job of educating people. And for that reason, that is the reason why we have this informative class. The average person out there, Karen, does not know why you're coming here. And if they think they know why you're coming here, they probably don't have an accurate understanding. And so quite frankly, folks, I need your help. And I'm going to give you some layman's definitions to help us explain to this. Because sooner or later, Kent, somebody's going to find out that you're coming to see Dr. Hall at Hall Chiropractic, and they're going to ask you, what is a chiropractor anyway? And so I'd like to give you a layman's definition that if you can remember, you can help me help them. A chiropractor is a specialist in the motion of the body as it relates to the nerves. Let me say that again. A chiropractor is a specialist in the motion of the body as it relates to the nerves. Now the next thing that's going to happen is the patient's going to say, or the friend is going to say to you, Charles, what does the chiropractor do? And the last thing I want you to say to he or her is, well, he pops my back or he cracks my neck, because that's not what I'm doing. The sound, as I may have told some of you, is nothing more than a little space being created inside the joints and air from the surrounding tissues rushing to fill the space. I can move each individual segment 7 different ways in your spine. Some of them will create sounds and some of them won't. So we don't want you to correlate the quality adjustment or treatment with the amount of sound effects because it doesn't really matter. It's what I'm feeling underneath my hand when I move that individual segment. So the treatment term that we'd like you to use is the term an adjustment. The chiropractor adjusts the spine or the body part, be it the shoulder, the wrist, the knee, the elbow, whatever moving part it is, to restore normal joint function. In order to become a doctor of chiropractic, it takes today between 7 and 8 years. The educational experience is totally controlled by the Department of Education, the United States government. The chiropractic colleges are also controlled by the National Board of Chiropractic Examiners. In fact, the student during his course of study takes over 4 national board examinations that take several days each test to make sure that the student is fully qualified to become licensed. To become licensed as a doctor of chiropractic in the state of Texas, one must pass the state board examination for licensure, and this guarantees that whoever it is that's treating you in our clinic is going to be well qualified and do a very, very good job. A chiropractor then is a specialist in the motion of the spine as it relates to the nervous system. Why is it so important that the body is functioning as it should? The reason it is so important is because when a joint or body part does not move as it should, there are 2 things that happen, and they're both bad. And we're going to spend the majority of our time that we have remaining talking about those 2 things, but in order to do that, we need to have a little bit of review of anatomy. And this is a spine. It's not a real spine. It's only a plastic model, so you don't have to be concerned. But it's a pretty good rendition of what a spine looks like if you take everything else away. And as you can see, your spine is basically a group of bones that are stacked on top of each other. If you're talking about one of these, it's called a vertebra. The series of them, vertebrae, plural vertebrae. You have 24 vertebrae in your spine, and they're divided into 3 parts. The cervical spine, which is your neck, is divided into 7. We have 7 vertebrae, lettered and numbered C1 through C7. Your mid-back and upper back, the thoracic spine, lettered and numbered T1 through T12. Your low back or lumbar spine, you have 5 lumbar vertebrae. They're lettered and numbered L1 through L5. You'll notice when you look at your spine from the front or the back, it's nice and straight. When I see something like this, that gets my attention because now we have gravity pulling on that individual in an abnormal way, creating a stressor to that person's body.